We have our doctor here, Dr. James Yap. He is a dental surgeon, T32 Dental. Welcome.
Hello, welcome guys. Thanks so much for having me.
Is this your first time on radio?
Yes.
Oh, we absolutely love having new faces in the studio. Can you tell us how you got into this line of work?
Well, actually, for me, to expand a little bit more specifically on this sleep part of things that we're talking about today, I guess I spent a long time in part of my career dealing with implants, restorative, the general dental stuff with cleaning and fillings and things like that.
Mm-hmm. Yep.
But, somewhere along the way, I realized that dentists are able to do so much more. You know, we're actually able to change lives, and that's how I got into sleep apnea, because so many of my patients are breaking things, they're grinding their teeth, and I'm hearing that they're snoring or they're gagging when they're cleaning, so this is actually a sort of a passion project for me.
This is the first time I'm hearing this, because usually for sleep apnea, we go to an ENT.
Yes.
It's got to do with the nose, maybe it could be a septum that's deviated, it could be something in the nose region, but for a dental surgeon to talk about sleep apnea is a little bit different for me.
No, it's definitely slightly different. But actually, dentists are so well positioned to be at least participating in this medical care pathway. I find that we see patients all the time. They're healthy. We see kids as well. Healthy kids, supposedly. And actually, I was just talking to Sophie about it, and that actually we're able to prevent all these things from happening before they become adults. Yeah,
this is news to us because we've been talking about sleep apnea quite a lot on the show. We have had an ENT doctor, we've had other dentists on the show, and the more we talk about it, the more we realize everything is interconnected. But to hear that because you have a condition like this, it doesn't mean you have to sort of surrender to the condition.
Well, when I was younger, I always thought that, I was just being a real man.
What, by snoring?
Yeah,
well, there's not a lot of information about this, right?
No, 100%.
And as parents, we want to catch it. And you were saying you can catch it and you can tell when a child is what you describe as a mouth breather. And that links to sleep apnea. Can you just, for someone who doesn't know anything about it, talk us through that?
For sure. Honestly, in Singapore, with the recent statistics, there's actually 30% of people in Singapore who have sleep apnea. And that's like on the higher end of the disease. And on top of that, 91% of them are not even aware. So in Singapore, I think you can throw a rock and hit someone who probably has sleep apnea.
Well, as the expert, you probably have an eye for picking up on this before you even get them to open their mouths. What are some of the things, if we're listening in, that we should be thinking about or looking out for?
So one of the really important things that I tell the dentists, because I teach at conferences and do courses for other dentists. One of the things I tell them to watch out for, especially for kids, is you can see their facial shape. If their jaw is receded, or they look like they have small jaws, or they have crooked teeth. This one you have to look in the mouth, but you can see if they have a high arch palate.
Okay, so there's that. Anything else?
A deep bite. Sometimes if kids bite,
like an overbite
quite a lot. Yes, exactly.
Anything to do with the sound they make when they breathe, or that's not always the case?
No, exactly. That's a really good point that you've made. So if we can hear that they're always congested, they're always blowing their nose in the morning, or they always have like a sensitive nose, sinus, they have to sleep with the aircon off, that sort of thing. Those are red flags for us.
Wow.
So what's the corrective action for like kids with an overbite? Braces, you're saying?
In a way, traditionally, and this is completely okay, by the way, it's not that this is wrong or it's incorrect, but I think a lot of new research has come out in the last 5-10 years that improves our sort of evidence base. And we found that actually if we intervene a little bit earlier in kids, we're actually able to prevent all these things. So to answer your question, we can actually intervene and do sort of interventional strategies by expanding the upper jaw. And that actually improves the space they have in their mouth and their throat.
We're not talking about surgery, right?
No.
Okay.
So that we use expanders in the roof of the mouth. And it actually slowly creates more space, turns that high arch palate into something a lot broader.
It could even be exercises, for example.
Yes, exactly. Myofunctional therapy is a thing, and it actually works if provided the child's compliant.
Okay, so what age would you typically say is the best time to intervene?
18 months. No, I'm just kidding.
Is it like 4, 5, 6?
Well, actually, below 5.
Whoa.
Yeah, below 5. So sometimes we're actually seeing a lot of these signs.
You
where
can actually see below 5 already.
Yeah,
Oh, so
because
it's 2 or 3 years old.
it's probably a little bit hard to intervene when they're that young, but we're starting to pick up all these signs. We can see them already. Kids are mouth breathing. They've got enlarged tonsils and adenoids, and they're always getting, or like to put it more simply, like they're always getting sick.
My goodness. Okay, so when in doubt, get your child to a dentist.
You can't blame my parents. This is like new study,
No. Even as he's telling us this, right? I feel like I'm quite well versed in stuff. I've got 3 kids, and I'm like, what? We didn't know that we had to bring them to a dentist for this. So definitely go and book in to see Mr. James Yap.
Alrighty. Dr. James, stand by. We'll ask you more questions about
Thank you.
A possible contraption that you're saying for people like me.
Is there a certain outlet that you are always at, or where do you work? Can you say?
So I'm at Camden Medical Center. Yes. Yeah.
Okay.
You don't have to say what level, but T32 Dental.
17.
Oh, 17. Okay, so you can call and make an appointment with him, especially if you're suffering with obstructive sleep apnea, snoring, maybe something doesn't feel right.
It's so funny that you mentioned that this is your passion project.
Yeah.
So it's like a sideline. Is it something that you are now focusing on, or it's alongside the other things that you're doing as well?
Well, it's sort of it all joins together, right? So when I say passion project, I mean that traditionally, like I said before, we do fillings, cleaning teeth, implants, and all this sort of thing.
Something
exactly, and this is
yeah.
something different that sort of complements it.
Right.
And I spend such a long part of my career treating adults, but when you treat adults, you can only sort of treat the disease. You can't actually prevent or cure it.
Okay.
And now, for the first time in kids, we're actually, especially there's a consensus statement in Singapore done by all the medical doctors and other dentists as well, and they've said that they've recognized dentofacial growth or dentofacial orthodontics as something serious. So we're able to actually influence kids' facial growth pattern.
Okay, so getting to the root of the problem.
Exactly. So we're able to look upstream for the first time in so long.
The root of the problem.
The root of the problem. I was going to see how long it was going to take for you to cotton onto that. But I think it's really interesting because when we think of teeth, we just think very superficially of the color and the shape, but we don't think about how it affects our breathing, our brains. We were talking about this, right? If you've got a child that is having trouble getting oxygen at night and they're a mouth breather or they can't breathe, how are they going to do their exams?
Yeah, it's going to affect, right? Because no oxygen to the brain.
Right?
100%. It affects their concentration at school. In fact, a lot of kids even get I wouldn't say misdiagnosed, but they find that they also have ADHD, because they're so tired. Like the symptoms are sort of overlapping, right?
Right. Wow, very interesting.
So for me, I mean, I've got a septum that's deviated, and I noticed that, for example, when I breathe, right? When I breathe in, I'm a mouth breather, so when I breathe in, even though there's nothing,
clogged up in there.
Yeah, obstructing it, you can see like there's a bit of a resistance to my airways, right? But when you hear Sophie, when she breathes in, can't really hear anything. It's so nice and clear.
Nice and smooth. That's what we want.
So that's what I noticed in my daughter as well. And that is when she breathes in, I can hear there's some resistance. And we do all the flushing and everything's cleared. So it could be something there. She's got a bit of an overbite as well.
Yeah.
So I think, in terms of getting it sorted. At this age, she's 4.5.
Oh, yeah.
Do you think that's a perfect age to start things?
100%. 4 to 5, I think most of the maxilla, the upper jaw, finishes or undergoes its biggest growth 7, 8, 9 sort of thing.
After you lose the first teeth?
Yes, something like that.
Okay, so we have a bit more time with that. And if you are listening in, I don't think it's ever too late to address a problem.
No, for sure not.
I think there's so many things we can do. And you were discussing this because you were saying that our very dear Gerald here, he does sleep with, what do you sleep with? A
CPAP.
CPAP machine?
Yeah.
And you were saying there's something else on the market. What's that?
So for some patients who, with sleep apnea, there's mild, moderate, and severe. So for some patients who don't like the CPAP, or they've had trouble with it, or they've failed it for whatever reason, they're not using it, or they can't use it due to their nose or something, we're actually able to help. So together with the ENT, we work collaboratively, together. They can clear the nose and make sure that everything's okay inside, fix the deviated septum. We can maybe expand the upper jaw to give a little bit more space in some situations. Okay. And on top of that, if you're still having problems, we can make a mouth guard. a special type of mouth guard that pushes the jaw forward so they're able to breathe better.
And these mouth guards are like customized specifically for the
What
person,
color
right?
are they? Clear
What
or
are you
do we have
asking?
color? I'm just
Yeah.
checking. Sometimes got to check, so it's clear.
Yeah, well,
Okay.
and there's white and there's a light pink, like translucent pink.
Just ignore
you
her.
could put some
We
stars
don't
in
care
there.
about colors. No.
When I was a kid, a friend of mine had a mouth guard,
Yeah.
retainer, and it had
yeah.
stars in it.
Yeah.
I remember
No, no.
thinking I need one just like that.
What we're talking about right now is you only use it when you're sleeping.
Yeah, it's cool.
You don't have to show people.
No, I mean, it's a whole vibe. All right, we're going to play a little game with Dr. called Truth or Myth, moving swiftly along, right? I'm going to say a statement and I want you to tell me whether it is garbage, there's truth, how much truth.
Sure.
Okay, first statement. The shape of your teeth can impact your health.
For sure. If your teeth are crooked or they're not in proper alignment, 100% that can affect the way you breathe, just like what you mentioned earlier, Gerald. And also, especially in kids, it affects how their face grows.
Okay, so it's true.
It's definitely true.
Okay, dental health is genetic.
Yes, there is some truth to that.
Wow.
There is some truth to that, yeah. Because some people can be, for example, like super disgusting. They don't brush their teeth
Yeah.
or whatever, and they just don't care, but they don't have any decay or
Yeah.
they don't have any gum problems.
How's that so?
Yeah, because, well, this is getting into it, but some people...
Gerald's so angry.
Yeah.
How's that so?
No, it really upsets some patients because, for example, the husband will not care about his teeth and go to the dentist once every 5 years, but then he's got no gum problems and no decay, and then the wife will be obsessively brushing 3 times a day, and she's
Wait. How do you know
losing
if you
gum.
got gum problems? That means when you brush, you bleed when you brush.
Like sensitivity,
That's one of the things,
receding
exactly.
gum.
Yeah, exactly. Well,
Wow, I'm a dentist.
yes, basically. Yeah.
Okay, number 3. I need to brush my teeth 3 times a day to have healthy teeth. Okay, you kind of touched on this.
Yeah, we did.
So it's no.
Not really. I mean, minimum 2, I would say. Yeah.
Okay.
Minimum 2. Got ya. Morning and night.
yeah.
Okay, and lastly, bad breath is a sign something isn't right with your health. Dun dun dun.
Ooh. Oral health for sure. Well, bad breath can come through in a number of ways. I mean, most obvious is the dental part. If you've got food in there or you've got decay or gum problems even, if there's food and stuff rotting inside your mouth and you're not cleaning it every day, of course that's going to contribute.
Yeah.
But some patients who have medical issues, let's say they've got some reflux or some infection somewhere else.
It could come through.
Exactly. That can come through as bad breath as well.
Okay, that's so interesting. Okay, it is to me, it's just amazing to hear these things. So I think if you're listening in and let's say you have problems with your teeth or your gums, you shouldn't blame yourself. You can always see a doctor. You can find out what the reason is behind it rather than just thinking, this is just the way that my teeth are. I can't fix it. Is that right?
Yes, we always hit out.
All right. Wait. I'm still very intrigued by the fact that some people don't have to brush their teeth and they don't get cavities. What's going on? What's the reason behind that? Are they drinking too much tea to like remove the antibacterial? I don't-
Well, it's not exactly that they don't need to brush their teeth. It's just
Okay.
that for some people, because gum disease, the way gum disease works is that it's actually your own body's reaction to the bacteria.
So their body is very strong.
Yeah, well, in
The
a way.
body doesn't react.
Or rather, it's people who have periodontal problems or gum disease, their body overreacts to it. It's an immune reaction.
Oh.
So yeah. For the record, I'm not saying don't brush your teeth.
Okay,
but-
of course.
Take care of your teeth. But have you heard of Jessica Simpson? She's famously known for she did not like the feeling of the smooth teeth after brushing.
Oh, really?
So she only brushes a couple of times a week back in the day, but will use mouthwash.
Yeah.
And that really blew up
Yeah.
over the internet back in
Yeah.
the day. And people were saying, what? And she said, yeah, I don't like the feeling of the smoothness.
Yeah.
But you've got that nice smoothness when you brush. So
Yeah,
you
for
have
sure.
to brush, right? Because that bumpiness is plaque.
Well, it's bacteria
Yeah.
on your teeth, and that can lead to stains, can lead to gum problems and decay, obviously. Yeah,
Okay,
yeah,
one
yeah.
last question that is,
Yes.
so my daughter went to the dentist recently. She's only 4.5.
Oh, that's good.
And the dentist actually said, because I was worried because, she's got a lot of like spaces in between her teeth. I was like, oh, do we start her with like braces now? And they're like, no, because spaces for kids are very good.
Yes.
Why is that so?
Yeah, because baby teeth, by design,
Okay.
are actually smaller than the adult teeth. So for kids, any child like around the age of 5+, they should have spacing. You know that ugly duckling stage where they have some adult teeth, some baby teeth. It's actually really good if
Okay.
they have space. Because if they don't have space, then the adult tooth doesn't have space to come down. So it's really important.
okay.
Like half my job is to make sure there's enough space and create that space.
Right.
Yes. Okay, Coco,
Exactly.
you're going to be fine. I got a daughter with like the biggest jaw, my middle
Yeah.
one, and there's a ton of spaces.
Yeah, that's
She
good.
kind of looks like Toothless from that
Yes.
Disney show.
At least you can
it's cute.
help with space, lah, right? Then you
Yes,
can
for
tighten it in the
sure.
future and everything.
If you have space,
Typically
you have
that's not a
options.
problem.
Yeah.
Typically that's not a problem.
All right, Dr. James Yap, thank you so much for joining us. You're from T32 Dental.
Yay.
Book in
Thank you so
today.
much.